Center for Advanced Research project looking at the impact of climate change and brain infections. So this is a nationwide educational initiative where we'll be rolling out two flagship webinars, one with the theme of Let's Talk Brain Infections and one with the theme of Let's Talk Climate. So today we have our esteemed speaker, Dr. Poornima Prabhakaran, who's a prominent Indian physician, epidemiologist, and a public health researcher specializing in the intersection of environmental health and climate change. She serves as the director for Center for Health Analytics, Research and Trends within the Trivedi School of Biosciences at Ashoka University. She's also a senior research scientist at Center for Chronic Disease Control, and she is also playing a major role in global advocacy as well as in the Consortium for Climate Health and Air Pollution Research in India. So we are very happy to have ma'am start this inaugural first session on Let's Talk Climate webinar series. And over to her to give us this lecture.
Yeah, thank you, Dr. Angel, for the kind introduction, and good afternoon, everyone. Welcome to all the participants who have joined us here online today. As Dr. Angel said, this is the first in this series of webinar called Let's Talk Climate. And in the spirit of this being an introductory webinar and also kind of probably a very mixed audience that we expect here. Oops, sorry. Are you able to see my screen? 1 second, I think my apologies. This is visible now, right?
Yes, yes.
Yeah, thank you. So as I was saying, in the spirit of this probably being both an introductory talk, but also most likely a mixed audience. It was directed for health professionals, but even within health professionals, we have so many, doctors, nurses, the medical forces, and probably we have some general interest in other sectors, people who are joining here today. So what I will hope to cover in my talk today will be just an overview of climate change concepts, just to have everybody on the same page as we go through this series in this webinar of Let's Talk Climate. I will definitely touch upon impacts of climate change on human health, then move on to climate change and the links to health system. And finally, what is really our role of health professionals and the health sector in this new, era of the changing climate. So to bring everybody on the same page and, at the cost of sounding cliched, I think I wanted to start with this very basic discussion on what is climate and what do we mean by climate change. So really, it's often confused by people who talk about this, sorry. Yeah. So have trouble distinguishing it from what we talk about every day, which is the weather. So weather is actually what the conditions of the atmosphere are over a shorter period of time. We often discuss like weather is a state of the atmosphere. Today is a sunny day, today is a rainy day, it's a stormy day. So that's what we mean by the weather. It's the conditions of the atmosphere over a short period of time. And it could be minutes to months changes in the atmosphere. Relative to that, when we talk about climate, this is how the atmosphere behaves over relatively longer periods of time. And it's usually the composite of prevailing weather conditions in a region, and it takes into account temperature, air pressure, humidity, precipitation, sunshine, the wind speed, and all of these different things averaged over a longer time period, usually a series of years. And therefore, when we talk climate, we mean the long-term averages of daily weather conditions. So in that sense, really, the difference between weather and climate is that measure of time. And both of these, both weather on a daily basis, too, if it's a stormy day, you're not going to be able to do your usual activities if you had a choice. And climate, both of these affect both life as well as human activities. But when we're talking about climate change, it is the changes that occur in these long-term averages of daily weather, which can have really ramifying effects on these aspects of our life, both our lives as well as our livelihoods, as well as health. It's not uncommon nowadays to see these kind of articles covered in media. So this is from the New York Times, which said 2015 was the hottest year in historical records, scientists say, and it captures a series of visuals from around the world, the family that is sleeping on the terrace in Delhi, or this kind of flooding in another part of the world, a haze, I think this was in Singapore, and then the drought conditions in Africa. So whether we like it or not, what is now a globally accepted fact is that the temperatures are going to be rising. And what that's leading to actually is a globally warming world. So we are somewhere here in 2020 to 2029 decade, but by the time we get to 2099, we're probably going to be really living in a red hot world. That's the rate at which the global surface temperatures are increasing. And just to show, these are what we call as scenarios according to the Intergovernmental Panel on Climate Change. And what they do, oops, I lost my screen again. Sorry.
Seema, is there an issue? Oh.
Um, you can see it?
Yes, yes, we're able
Yeah.
to see this. Oh, now we lost it. Yeah. You can
Yeah.
share it again.
Yeah. Apologies. Yeah. So you can
Yes.
see, right? Yeah. So what this is showing is if we continue doing what we are doing, what we call as business as usual scenario, we're only going to keep contributing to the rise in temperature over time. And that is really seriously going to have serious implications around globally. And just to give a snapshot of what this looked like over time. So this graphic is actually showing us over time. This is the x-axis, which is showing the year. What has happened is, especially in the last 1,000 years, and most evidently from the like 1970s, 1980s, when urbanization was at its peak. What you're seeing here is the change in the use of fossil fuels as well as the change in land use really started peaking. It started peaking from this time and only kept going upwards. And corresponding increase in concentrations of carbon dioxide in the atmosphere, I'll come to that, and the corresponding increase in the temperature change. This is the global surface temperature, all of which are like moving skywards. So this is what is the scenario globally. So this graphic is a very, playbook kind of thing of explaining the the greenhouse effect to anyone. And what it shows, what it captures here is, the solar system on the one side, which is kind of warming the surface. Half of the solar radiation is absorbed by the Earth's surface and keeps it warm. Much of it is reflected back into the Earth and the atmosphere. But there is also this infrared radiation that is emitted from the Earth's surface. Again, much of it passes through the atmosphere, but a good amount of this infrared radiation is captured in the lower layers of the atmosphere by what are known as the greenhouse gases. And that actually leads to the warming of the lower layers of the atmosphere, what is known as the greenhouse effect, mostly implicated in the changing climatic conditions we are seeing globally. So what causes this changing climatic condition? The implicated greenhouse gases that we often keep talking about are molecules that have the ability to trap heat in the lower layers of the Earth's atmosphere, causing this greenhouse effect. And the biggest culprits we often talk about are carbon dioxide. There's also methane, the nitrous oxide, and fluorinated gases. These are chlorofluorocarbons. These are man-made chemicals, more potent than carbon dioxide. But if you see over here, this graphic, this histogram, the biggest chunk over time has been carbon dioxide. It moves in and out of the air through the carbon cycle, stays for the longest time, and it contributes the biggest proportion. Over time, the carbon dioxide levels in the atmosphere have only increased. There's also the other two, methane and nitrous oxide, as well as the hydrofluorocarbons. But the biggest problems have been due to carbon dioxide emissions. And when we talk about global warming, we normally tend to refer to the emissions of carbon dioxide. These exist naturally and are playing an important role in the Earth's climate. Without them, it'll be quite a cold place. But it is human activities in the last 1,000 years and more in the recent decades and activities, especially in industries like mining and burning of fossil fuels. In many parts of the world, we are still so dependent on fossil fuels, coal, oil, natural gas. Currently, also, this situation is playing out globally with the war situation. We are really dependent on mining and using gases, coal, and for energy, for transportation, for several other activities that we need to do on a daily basis. And these burning of these fossil fuels actually emits carbon dioxide and other greenhouse gases. So this accumulation of greenhouse gases from anthropogenic is man-made, human activities is what is causing overall warming of the planet. What are the impacts of this? I mean, in terms of changing temperatures, increasing levels of carbon dioxide in the air, what are the climate change impacts that are going to be playing out across the globe? Definitely increase in temperature. There's going to be change in the precipitation patterns, in the pattern of rainfalls that is happening. There's also going to be, the sea level, the rise because of not just the warming of the water, but also melting of glaciers. Globally, if the temperature is increasing, there's going to be melting of glaciers, and all of that is leading to these impacts on the ground. In terms of impact sector-wise, if we look at it, it is wide-ranging. For us, the important sector that we are all connected is the health sector, and there's definite impacts on the health sector in terms of increasing disease and as well as mortality from a range of different impacts of climatic conditions. But there's also impacts on sectors like agriculture, on forests, changing biodiversity, there's changing in the ecosystems, in also the plants, the animals, there's impacts over there, and which are closely connected to the human ecosystems as well. Water resources are affected in terms of quality, in terms of quantity, and there is erosion of our coastal margins. So erosion of beaches, inundation of our coastal lands, as well as the communities that live and are dependent on these coastal areas for their livelihoods. And of course, loss of habitat and species. So this graphic really captures the impacts across sectors of the changing climatic conditions. But for this audience, I think I really like to use this graphic, which is like the one-stop shop that captures what is happening in terms of impacts of changing climatic conditions on health. And if we look at this, starting from the inner circle, impact of climate change on human health and the consequent exacerbation of existing inequities. We already have inequities in terms of socioeconomic status, but also in terms of health, in terms of access to health. What's going to happen with increasing anthropogenic activity causing rise of carbon dioxide, rising temperatures? There's going to be more and more extreme weather events, heat waves, droughts, floods, cyclones, storms, and of course, rising sea levels. And what the effects are going to be in terms of impacts on human health are what is depicted on this outer part of this graphic. So if I start from here, burning of fossil fuels and spewing all these pollutants into the air as a country also, India, we are still dependent on thermal power plants which burn coal. So the pollutants that are spewed into the air from this activity causing changes in air quality, air pollution, and the accompanying other particles in the air are exacerbating for sure asthma and other respiratory diseases, but more and more evidence is now being documented on its impact on cardiovascular disease as well. What is happening in the space of water quality? There's waterborne diseases that happen, especially after floods. Post floods, there's a lot of overflow, stormwater, and there is a spread of waterborne diseases. So things like cholera and other waterborne diseases are becoming more and more common as a consequence of changing climate. On the other side, drought can lead to malnutrition, again, impact of disease transmitting agents in water supplies, leading to get diarrheal diseases. And this is playing out in many, many areas across the country, but also globally. There's extreme heat that is being manifest in many parts of the world, and the heat-related illnesses and death, but also exacerbation of existing comorbidities like cardiovascular disease, strokes. These are also happening more often now. And more importantly, especially in a country like India, changing climatic conditions, changing temperatures are causing changes in vector ecology. And it's very relevant to the project, Climb India project that we are doing, that the conditions are becoming more favorable for the transmission of vectors. And things like malaria, dengue, encephalitis, chikungunya, West Nile fever, all the brain infections that we are looking at in the Climb India project, they're all kind of linked back to favorable vector conditions, parts of India that have not seen, for example, mosquito-borne diseases. The Northeast are seeing more and more, conditions resulting from changes in vector ecology. More distally, we see things like injuries, fatalities, loss of homes, and downstream impact is on mental health. Not to forget this whole thing of mental health. There's a new term actually coined for this called eco-anxiety, and another term called solastalgia, both of which actually speak to the impending sense of doom, especially among youngsters, because of changing climate, and this feeling that the changing climate is going to impact their future. This whole eco-anxiety term is becoming a new area of interest, not just for academics, but also for programs and policymakers. Um, and finally, degrading of living conditions, exacerbating social inequities, but also a lot of forced migration because of effects on lives and livelihoods, causing people to migrate. And there is this whole term of climate migrants as well that is being talked about now. Not to mention the fact that it can often lead to civil conflict because you are losing access to basic necessities of life like food and water and housing, nutrition. There's loss of jobs. So a lot of these things are playing out, especially in the global, what we call the global south. And I want to draw your attention to this picture which was featured in the 2009 edition of the Lancet. And what it's showing here on the top half is the legacy emissions. It's a heat map where the legacy carbon emissions came from. So what you see here, it's mostly the developed part of the world that was responsible for the greenhouse gas emissions in the past few decades because of unhindered, growth and rapid urbanization. But most striking is this lower half of this graphic, which features the health consequences. And what we see here is, though these were the countries that were not responsible in those decades for the greenhouse gas emissions, today these are the ones that are facing the most impacts in terms of the consequences on their health. So there is no place for complacency for people in this part of the world. We may not have caused the climate change in a direct way, but we have no place for relaxing and seeing what to do. But we have to act now because the health consequences are far and wide, and it's particularly so in the Africas and in the South and Southeast Asia regions. So why are we talking about climate change? We, as in I'm talking about people like us who are working in the health sector. It is being touted as the biggest public health challenge of the 21st century. So we're seeing wildfires. I was talking about melting glaciers. There's the spewing of pollutants from burning of coal in the power plants. All of these leading to changing climate and making it the biggest challenge of the 21st century. But I don't want to make it sound like it's all gloom and doom, because we like to also look at it as the biggest public health opportunity of the 21st century. We now know that this is a problem. We have accepted the problem. We have a lot of actually solutions to the problem. Therefore, we can look at it more from a positive side and a positive narrative and say this is our opportunity to act, because really there is no planet B. And we really need to take action now to address not just the impacts on health, but also on our health systems. And I'm going to spend a good amount of time towards the end of my talk on what it's doing to health systems as well. To capture actually the global climate challenges for public health, I'm drawing from some data that WHO has shared in recent times, that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year. And big chunk of this will be from malnutrition, from conditions like malaria, from diarrhea, and from heat stress. And if we have to estimate the direct damage that it causes to health, excluding the health other sectors related to health like agriculture and wash sectors, Just the direct damage to health would be in the range of US $2 to $4 billion per year by 2030. And that's not a small figure. It's a staggering amount that's going to be lost as a result of climate change. And additionally, every year there's going to be deaths due to weather-related disasters. And mostly it's going to be the developing countries, including India and other countries in the Southeast Asia region, who already often are having weaker health infrastructure, but also overburdened because the health workforce does not match the populations that we deal with. So in general, we are more vulnerable. But if we just again put a cost to it, this was a report about 5 years ago, which actually quantified the losses. And apparently, India will face high social and economic costs from climate change. And they quantified it by saying that every additional ton of carbon dioxide emission will cost India 86 US dollars, ahead of countries like US and Saudi Arabia. Therefore, I mean, the implications of climate change for India, it cannot be understated. We need to come together to take collective action. If we look at the Global Climate Vulnerability Index, which is put out by a global German observatory, India features among the top 10 countries in terms of climate vulnerability. And it's really a reality check for us now. And this is figures, and if you talk about the different impacts, I mentioned heat, droughts, floods. But in terms of heat, I wanted to point to this report from the UNICEF, which said by 2050, we'll have about 2 billion children on the earth. And the numbers, the frequency, and the intensity of heat waves is only going to increase. And really, this is the coldest year of the rest of our children's lives. This is what they mean to say by saying that it's only going to get hotter. And for our children, protecting them from these impacts of climate change is really, really an urgent imperative for all of us. If nothing for the future demographic dividend, our children, it's important to take action. I wanted to linger a little bit on other direct impacts of climate change from a global lens, and water insecurity is going to be a major problem. So this is just a map showing globally what the situation is. There are many parts of the world that are okay, doing okay. There's little or no water scarcity, but you can really see again, it is this part of the world, the developing countries that have imminent physical water scarcity. And where we have water bodies, they are often polluted. So this is really alarming, and this is data from Aquastat, which actually shows the regions of the world that are facing water stress and water scarcity. And there's a definition for a water stress country, meaning there's less than 1,700 cubic meter of water per person per year, and if water scarcity is less than 1,000 cubic meter water per person per year. And India is actually already a water stressed country. In terms of precipitation, which means the changing rainfall patterns, again, globally, the patterns are changing. And this has implications, like I mentioned before, for things like vector-borne diseases. Sea level rise. This is a little old data, but the fact is still true that the sea level levels are also rising. And this is in 2016 at the rate of 3.4 millimeters per year. It seems like a small figure, but actually the impacts it has for coastal communities is in terms of both livelihoods as well as impacts of floods that come at more and more frequency in the recent years is actually huge. This is actually a graphic showing impacts on the food system. So changing temperatures and increasing temperatures around the world mean that increasing temperatures can affect crop productivity. And for many parts of the world which are so dependent on agriculture, India is also largely an agrarian economy. And what's going to happen in terms of crop productivity is it's only decreasing. And the changing temperature also affects the rate at which crops mature, which means the nutrient content of the crops is also changing. So we are not only facing a glaring crisis of food insecurity, but there's also nutrient insecurity. And I don't have to explain to health professionals what it means in terms of impacts on nutritional health of our populations. In terms of the relation to climate change, there is also another term that I would like to bring to this audience, which is spoken in the climate world. It's called the syndemic. which means that there are three pandemics playing out globally. One is the pandemic of undernutrition, which is still there in countries like Africa as well as in India. Undernutrition is still to be arrested. But because of the crop productivity being affected and food insecurity being a big issue in many parts of these countries, more and more people will actually move to eating processed food, which means you're fueling another end of the malnutrition spectrum, which is overweight and obesity. So there's three simultaneous pandemics of undernutrition, overnutrition, and the pandemic of climate change that are feeding into each other, fueling each other, and causing this situation, which is a global syndemic, occurring together simultaneously. So, since this is an introductory talk, I wanted to kind of bring a fair feeling about all the different aspects of climate change. And this one is from the impacts on food and food systems and nutritional security. To take the lens of what's happening in our part of the world, it's important for us to know about India, but this situation is similarly playing out in all our neighboring countries. So it's nice to have a sense of what's happening in South Asia. Really, we are living a new climate normal. So it's floods, it's air pollution, it's droughts, it's storms. This is happening in all our neighboring countries at increasing frequency. So there's all the UN agencies and especially the World Bank, which is really trying to take action on this front. And they have already documented it is one of the most vulnerable regions to climate shocks of all kinds: heat waves, cyclones, droughts, floods. It's testing our limits, testing the limits of government, to the businesses, the citizens, but also the health sector. And that's where we will focus in a bit. But just to say that half of all South Asians will be living in who are living in these 8 countries are really going to be affected at increasing frequency from climate-related disasters. And I wanted to say again, it's not all doom and gloom, because this region, South Asia, is also the region which has been pioneering many climate smart solutions. Lot of innovative community approaches, for example, to coastal resilience, for scaling up renewable energy use, regenerative forestry. Some of the best examples of climate adaptation are actually coming from this part of the world. So there's good examples to learn also from our own country, but also from our neighbors in the Southeast Asia region. So whether it's heat waves like this that we are seeing in India, we are at the edge of the next heat wave season starting in India. It's not just the daily day temperatures, but it's also night temperatures, which has implications for people having a good night's sleep. If it's so warm that they're not able to sleep, the next day's productivity is affected. And where children are concerned, they're having inattentiveness in school, not able to concentrate. It has impacts for the children and their education outcomes as well. So heat is a big one that has to be looked at from multiple lenses. And in other parts, in our neighboring countries, floods. This is something that we are seeing again in all our neighboring countries. Floods in India, in Indonesia, in Bangladesh. This is one of the most flood-prone regions. And this is just in the vicinity of West Bengal. So what happens in these border areas has implications for many parts of our country. Sundarbans, for example, in West Bengal, some of the most vulnerable populations in our country live in the periphery of this very high flood-prone region. Nepal, again, fourth globally in terms of climate vulnerability. And what happens here in terms of extreme precipitation and flooding, the glacial lake outburst floods, GLOF as we call them, has impacts for states like Bihar. And impacts of the flood in Bihar is a big area of concern. Oh, God. Sorry, every time I seem to... is a big area of concern for people in health professionals living in the state of Bihar, because floods come annually and it has impacts for the populations in the state of Bihar. Maldives is another small island developing state also in our region, the Southeast Asia region, which is a coastal island, and it has lives and livelihoods dependent on a lot of things like fisheries. But ocean warming, acidification, degradation of fish stocks is happening in these, and some of these small island developing states, as we call them, are actually getting submerged. But this is a very striking graph here on top, which is actually showing, who is responsible for the fossil fuel emissions by country. And here is Maldives, which is literally like barely contributing to any of the emissions, but is rapidly submerging as a country because of the emissions and impacts on climate change that are coming from other developed parts of the world. Um, Finally, on agriculture, I wanted to again draw your attention to agriculture. It has economic impacts, not just for Bangladesh, but for all these countries in the Southeast Asia region, Afghanistan, Bangladesh, Bhutan, India. While the global average contribution to agriculture, to GDP, is about 4%, our country, Afghanistan, Bangladesh, Bhutan, and the average in South Asia, about 16 to 20% of our livelihoods contribution to GDP comes from agriculture. So if agriculture sector is being affected, it impacts the national economy as a whole. Next, I wanted to change tracks a little bit to talk about who is facing the greatest impacts, who are the vulnerable groups who are facing the climate events. Everybody faces the climate events, but greatest and disproportionate significant impacts are on the vulnerable groups, which is our children, women, especially pregnant women exposed to things like air pollution, people who are already sick, elderly, those who are living alone, and marginalized populations with social inclusion. And South Asia, India is home to a lot of densely populated regions that house vulnerable groups. And the inequities in terms of health as well as nutrition, in terms of educational outcomes, but also in terms of healthcare access are most felt by these vulnerable groups. And this statistic that is put out by UNICEF on the Children's Climate Risk Index again shows our countries in this Southeast Asia region, Pakistan, Afghanistan, Bangladesh, India, the top 4 countries actually in terms of child vulnerability to climate change. Again, a very, very, sober fact for us to think about when we are trying to respond to climate change. So some images from around the world, more from the Southeast Asia region, what happens when we have these acute climate events? Children are often orphaned, they don't have homes, but there's also, this is actually a picture of a healthcare facility, which was actually brought down in the aftermath of a flood. And here, these are scenes that we saw a lot during COVID pandemic, when a lot of people had to move from their original place of residence. There is a term now called climate refugees. I don't know if how many of you have heard of this before, but there is actually climate migration and climate refugees. And this is a map globally showing people in millions who are being displaced because of climate change. So this is a very, removed lens, which probably we who are on a day-to-day basis dealing with our patients, we are actually not probably conscious of what's happening even at a global scale. There are people who are getting affected and moving from their places of residence. Changing track now for the rest of my talk to this topic about the health sector. What is the connect? We talked a lot about climate change as a science. What is climate change? What is its impact? What is its impact on health? What is it doing globally? What is it doing in the Southeast Asia region? But I want to focus now on the health sector because all of you, I'm sure this is a mixed audience, but many of us are reading in newspapers, we are hearing in different webinars like this about impacts on health, on every organ system actually. But what are the links of climate change to the health sector? One is, as people working in the health sector, we are really the first responders. When there's a crime happening, it's the police, who are responding. But in climate events, while there is government and urban, administrators who have to respond, health sector is a crucial first responder when acute climate events happen. And as a moral imperative, we all take the Hippocratic oath we have this oath that we take when we graduate from school, medical college, saying first do no harm. You'll be surprised about what I'm going to speak to you next. The health sector really can lead by example by demonstrating sustainability and while we do our daily job of protecting human health. And why do I say this? When we talk about emissions coming, I talked to you about emissions coming from global, different parts of the world, different geographies. But if we take that down to sectors, which are the sectors that are actually contributing a lot of emissions, the greenhouse gas emissions? A big chunk comes from the industrial activity, from the energy sector, from agricultural sector, transport, buildings. You can see the statistics here, how much 25% from agriculture, 25% from the energy sector, 20% or so from industrial activity, buildings, transport. What about the health sector? Does it have a role in contributing to greenhouse gas emissions? And do we need to care? Now, this is a very paradoxical situation. We are the health sector. We are supposed to do no harm. In fact, we are supposed to kind of protect people from harm and take care of them when they have illness. But really, there is a role of the health sector also in climate change. This is what I want to share with you. This is a groundbreaking report that was released in 2019 by an organization called Healthcare Without Harm. And what they did was actually quantify what is the healthcare sector's climate footprint. And it was found to be equivalent to about 5% of the global greenhouse gas emissions. So, in 100% of the emissions coming from different sectors from around the world, 5% actually comes from the health sector. And to just put that in perspective, it is equal to emissions from about 500 coal fired power plants. And if we were to take all the hospitals in the world together and aggregate them and rank them with countries around the world, the health sector would be the fifth largest emitter on the planet. Now, that was a very staggering fact that came to light in 2019 because of this report. And subsequently, a lot of work has gone into understanding what are these emissions that are coming from the health sector. And this is what we call our health sector climate footprint. It is not directly from the hospital per se, but it is because of all the goods and services that we need to deliver healthcare. So we need a building, we need energy, we need water, we need pharmaceuticals, we need people, and we need food for the patients that we host in our hospitals. So, directly or indirectly, by virtue of delivering healthcare, we are contributing to emissions. I want you to kind of digest this fact because it means a lot of different things. The use of hazardous chemicals, for example, indoors, it contributes to high rates of asthma among healthcare workers. There are also a lot of reproductive hazards from the use of certain, for example, imaging machines. There's carcinogens, mutagens. There's use of anesthetic gases, a lot of which is spewed into the atmosphere. Some amount is used, but there's a lot that goes into the atmosphere. There's also a big footprint of those anesthetic gases. Poor waste management, unhealthy food choices, and reliance on polluting technologies. So there's a big footprint of the health sector coming from a number of different constituents. And just to take a global lens to it, who are these people who are contributing to the health sector footprint? Again, they quantified this in terms of countries. And it's really 10 countries: United States, China, European Union, Japan, Russia, Brazil, India, South Korea, Canada, Australia. 10 countries which are responsible for 75% of the emissions in the health sector. All the other nations contribute the remaining 25%. But per capita, if we look at our own health sector footprint in India, because we are also a big population, per capita, it is a smaller kind of contribution. Nevertheless, I think it's important for us in the health sector to take note of the fact that we are able to kind of move to a more sustainable form of healthcare delivery where we are actually reducing our emissions for whatever it's worth. For currently, the quantified emission is 39 metric tons of carbon dioxide, which is huge. And for, again, perspective, equivalent to emissions from 10 power plants or 5 lakh tanker worths of gasoline or 8 million passenger vehicles being driven for 1 year. That's the equivalent of emissions coming from the Indian health sector. And most of it you can see here. I won't get into the detail, but there's something called Scope 1, Scope 2, and Scope 3 emissions of greenhouse gases. So Scope 1 is directly from the health sector itself. Scope 2 is because of the use of energy in the health sector, which is an important fact I want you to hold in your mind, which is why we have a whole lot of conversations going around on transitioning health sector to cleaner forms of energy, renewable energy. And scope 3 emissions in the health sector are from the supply chain. But all the supplies of goods and services that come to the health sector in order to facilitate the healthcare delivery things that we have to do. And which is why we as health professionals, doctors, nurses, when, for example, we are indenting for gloves or for pharmaceuticals or for IV fluids or all the different consumables, we need to create a demand for goods and services that are produced sustainably. There's a huge scope of work that is being talked about as sustainable procurement in the health sector. We really need to make sure that we are creating a demand for sustainable goods and products. And that is also addressing one of the SDGs, which is sustainable production and consumption. So I'm going to summarize in the last few slides actually what links climate change and healthcare. The increasing, I don't know how I'm doing on time, but Dr. Angel, I'll just finish in 5 minutes. It
Yes,
link,
ma'am. No
yeah.
issue.
What links climate change and healthcare? We need to have increasing recognition of the impacts of climate change on health. We have to recognize there's going to be a growing dependence on healthcare services. Climate change, climate sensitive illnesses, there's going to be a surge in those illnesses, and therefore there's going to be a growing dependence on our healthcare services. Simultaneously, we also need to remember our own emissions, which I just talked about in the last few slides. To do this, to deal with this growing burden of health impacts of climate change, we need to first be aware. How many of us in medical school have learned about climate change or impacts on health change? It is on human health. It is not in the medical curriculum. So first and foremost, I think we are working at the highest level to make that happen. But while we can, we have to make all our efforts to kind of spread the knowledge to the health workforce about the impacts of climate change. We need to increase our infrastructure to deal with this growing burden, but we also need to reduce our own carbon footprint, as I mentioned a short while ago. Question is, are we prepared? If not, this is really a wake up call to every person who's listening here and beyond. You need to take this message out to your colleagues in the health sector that we really need to prepare ourselves, because it's a pandemic that has crept up onto us literally in our backyard, and we haven't taken enough recognition of it. Health sector is really not prepared for climate change. This is a picture, a very sobering picture actually. This is from Tamil Nadu, the government hospital in Tambaram, and I think this was the 2018 floods, when people had to be moved out even from the hospitals. So climate change strikes at the very core of health systems, a health system, healthcare sector whose mission is to keep people healthy. Are we not going to be prepared to actually deal with situations like this? Sorry, this was 2015. But this is not just Chennai. This is a similar situation that panned out in another part of the world, in Puerto Rico, Hurricane Maria in 2017, and a similar situation in California as a result of the wildfires. So this is a tagline that we use, like climate change is really an equalizer. It doesn't see where it's going to, have its impacts. It can be Chennai, it can be California, but really health sector globally needs to be aware, needs to be prepared. And this call for action to the health sector really came in the COP21 in Paris to 2015, the famous the Paris Agreement that many of us have heard of. At that time, there was the first and largest call for action to the healthcare sector to mobilize this sector as a leader to advocate for climate change. For many people, we know, like people really value the word of doctors, even more so the word of nurses. There is high respect for doctors and nurses. So the health professionals really have a big role to play in addressing climate change, both from the caregiving that they do, but also to address, their own impacts on climate change. And this conversation just kept amplifying from then on. 2016, the first conference happened in 2015 at Paris, but subsequently a second conference when they said health systems really can lead by example. You advance models of low carbon healthcare that can improve access to healthcare services even in a climate change situation. And that should help not just to address the growing burden of disease, but also to reduce our own footprint. So, question we want to ask ourselves today is what can we do as climate and health responders? And this question was like came out in the Lancet, which is all of us are familiar with this journal, that climate change is the biggest global health threat of the 21st century. We have done enough, but we must continue to do this knowledge building, sensitization, awareness building about what is climate change, what does it mean for health, but we also need to understand what has already been done and what still needs to be done. And again, I'm just bringing this up again to sensitize everybody here that for us, the health sector, we really need to be sensitive about what are the health risks of climate change. In terms of extreme weather events, heat, air pollution, water scarcity, reduced food production. I've touched upon all of this, vector distribution. Who are the people who are vulnerable? And what are all the factors that make this vulnerability worsen in some parts of the world? And as health responders, we need to be aware. We need to be aware of especially this part, the health outcomes. What are all the health outcomes of climate change? But also we need to be familiar more and more with these terms of adaptation, mitigation, resilience. Adaptation really refers to the process of adjustment, whether it's actual climate change or expected climate change and all its effects on the population that we serve, but also its effects on our hospitals. Mitigation to reduce our own footprint, and then resilience. We should have the capacity to cope with these climate-related hazards and reorganize ourselves as well as our infrastructure to respond to climate change. And this is where we started talking about this concept of climate smart healthcare, which has these two pillars of resilience as well as mitigation. Resilience meaning a prepared health system which can adapt and respond to climate change, but also a decarbonized health system, which speaks to the mitigation actions. And this climate resilient and low carbon health systems is now a big area of work, not just in India, but globally. It's a big portfolio of work in WHO. And it speaks to the fact that doctors as first responders, health sector as first responders, we should be the last building standing, not just standing, but also functioning in the face of climate change. And we should be equipped to recognize climate sensitive illnesses. We should also be equipped to reduce our footprint. So this is at the cost of repeating. I want to bring to you the facts of adaptation and resilience in the health sector, but also mitigation. It is important for us as healthcare professionals to be very, very aware of both of these concepts. And there are enough guidelines and more out there that have come out in the last 10 years. This was World Bank that put out this guidance for climate smart healthcare. It talks everything about system design, building design, renewable energy use in the health sector, minimizing our waste, but also managing our waste, biomedical waste sustainably, having very sustainable transport and water policies, low carbon procurement, I've mentioned that before, but also resilience in our buildings. And we were fortunate to host actually a climate change and health role of health sector national health conclave in 2019 when we became aware of this concept and brought this conversation to the highest level with a white paper on climate change and health role of the health sector. We presented it to the then Union Health Minister, Dr. Harshvardhan. And we were fortunate right after that the Ministry of Health, which already had a national program for climate change and human health, actually then co-opted us as a center of excellence to actually help them prepare the health adaptation plan for India, drawing from a lot of global guidelines. So everything, our framework that we then developed for the ministry actually takes into account a lot of different things. The site of our hospitals, what kind of buildings, infrastructure, how do we use energy, water, food, how do we manage waste, transport, how do we link to climate information services? We talk a lot about early warning systems, but that should not be removed from, it's a Ministry of Earth Sciences which is putting out early warning systems. Are we in the health sector able to take that information and prepare and act and in a timely and appropriate manner? And I think we were fortunate. It was also the time when a lot of guidance came from different organizations, including the WHO, on the fundamentals of building climate resilient health sectors, whether it's equipping our health workforce, talking about our water sanitation, healthcare, waste management, energy, infrastructure, technologies. We drew from all of those guidelines to develop our health adaptation plan in India. But I just wanted to put this figure out here. This is from the Indian IPHS guidelines, which is just to show that we are not a country like UK where we have one health system, the NHS. This is how our Indian health sector looks like. We have public, we have private, we have multi-speciality hospitals, nursing homes, private clinics, we have railway hospitals, defense hospitals, and within the Ministry of Health, state and central run hospitals, which includes everything from hospitals like AIMS, but medical college hospitals, super specialty hospitals, down to community health centers, primary health centers, sub-centers. How do we make an impact on this entire health system, such a multi-tiered health system that we have in India? It's a job that is a collective responsibility. And this is where I want to leave the thoughts with you, just to show that it is not impossible. Estimated greenhouse gas emissions from the Indian health sector is quantified to be whatever this number is, but there is a lot that we can do to alter this current scenario. What this shows really is the fact that we have a mitigation imperative. We want to reduce our footprint, but if we continue business as usual, this is what is going to happen. We'll triple the healthcare's footprint, and we have no space to do that. We have to both do adaptation and resilience and deal with the climate sensitive burden, illnesses burden, but we also need to reduce our footprint. And there are examples from around the world. This is, of course, California hospital that has 100% renewable energy, but this is also Africa. Here is an example of solar energy being used to, to sustain the cold chain. Vaccines are being carried across the desert. So there's very many examples, and I'm going to quickly rush through the next few slides to show that action has happened at country level, at government levels. There's there's lots of guidance for both health ministries to become leaders in climate smart healthcare and do what it takes in terms of programs and policies. But it is for us on the ground also to respond to those mandates. And there's lots of development institutions that are putting out funding to help this kind of action. I'm sorry, I think I just have a few extra slides to show this. But to give examples from around the world, this is the Kaiser Permanente Hospital, which has 100% gotten into sustainable healthcare through a number of different actions for waste reduction, water conservation. And this has been possible even in our country. How do we achieve this is the question that is often asked. We have to start by understanding our own vulnerability. We have to take a stock of what we have. What do we have in terms of health workforce? What do we have in terms of stocks, in terms of infrastructure? Do an audit of our energy system. How much of energy, lighting, heating, equipment, have checklists for all of this, capacity building. And there is guidance for all of this in India. And I want to say that implementation for green and resilient healthcare cannot happen in one day. It's an incremental approach, and we can do it with enough planning, mobilization of resources, and joining hands for small low-hanging fruits, whether it's energy sector, transitioning to solar, LED lighting. There's options of cool roofs, wastewater recycling, rainwater harvesting. We can do all of this in our hospitals. And I want to share very proudly that we have pioneers in the Indian health sector. We've documented these case studies in very many hospitals across the country for energy efficiency, water efficiency, waste management, sustainable manufacturing. This is an example from Sitlingi, which is in Tamil Nadu, a tribal health initiative where they were able to kind of remove diesel gensets and really move to solar and actually have savings on the one side, but also deliver services uninterrupted in their OT, in their labor room. And so very many examples like this. I will share this slide deck because I really have a lot of examples from around the country, because it's a very proud moment for us to show it's not just California or other parts of the world. In India, we have good examples of resilience in the health sector. And it's examples that we can draw from, examples of best practices. So this is a PHC in Karnataka, serving indigenous people in BR Hills, and they have had a lot of issues because of long power cuts, people waiting for long periods. but they just, resilience in the form of just we're a sun-blessed country, using solar. They were able to have continuous electricity, which actually not just kept the services going, but it also improved morbidity in their patients. Again, a whole lot of examples from around the world about solar powered kind of facilities, from cold chains to mobile healthcare services, COVID kiosks, incubators that are powered by solar. A classic example here is the boat clinics in the Brahmaputra River in Assam. These boats actually go from one point to another, delivering healthcare services to the coastal communities. These are solar powered. So throughout the year, they are able to deliver services. A hospital that came up during COVID in Bihar, completely based on sustainable principles. Even the walls of this structure are agriculture stubble, compressed agriculture stubble, extremely sustainable, natural ventilation, and it is a 100-bed hospital that popped up in Bihar, in Masari, but completely based on sustainable principles. Cost savings that they were able to show, and these are endorsements from patients, from technicians, from the medical officer, who said we were able to deliver so much care to our people because of the way we set up our infrastructure. Yeah, a lot of examples that you can see from Jharkhand, from Meghalaya. And I want to say that, probably a question in everybody's mind is, how is this all going to be financed? I wanted to give this example from Karnataka, where actually there is funding. There is funding for all of this within the health system. And oftentimes the money is going back to the government because people don't know how to unlock these finances to do these initiatives. So I just want to say, for people who want, further information and all of this, we'll be happy to facilitate, because really we have a big and important job as communicators to address climate change. There's a lot of awareness building that has happened at government level, international level, on climate change and how to deal with it. There's public awareness now. This is just a public survey that was carried. What is the most important effect of climate change? And here's this huge chunk of people who are saying its impact on human health. So people know there's high public concern now about climate risk to health. But we really, as an international community, health community, have a lot of clear directions from WHO, which is the organization that we look up to, with a lot of guidance that has come from WHO to help us. But also there's a lot of capacity in India. That is something that I'm proud to share. The Ministry of Health has a national program for climate change and health, which is giving out a lot of guidance to the public health system to follow. And globally, I think we started this conversation in Paris in 2015, but post-COVID in Glasgow, if there was a lot of funding that was being put to come back as a resurgence post-COVID, we better do that in a healthy, climate-friendly way. So this was a healthy climate prescription letter. I was fortunate to be there when we submitted this to the highest level, to all heads of government, about building back better for the health sector. And it was endorsed by 40 million healthcare professionals from around the world. And so to summarize, finally, your role as healthcare professionals, you need to be aware about climate sensitive illnesses, have a vulnerability assessment done at your level for your hospital, have a prioritization of how you're using water, energy, and your waste management, build capacity continuously, but take this one step at a time. It cannot all be done together. And continuously evaluate yourselves about where you are in dealing with this. And I'll close with this statement from my mentor, Dr. Srinath Reddy, who was responsible for setting up the Public Health Foundation of India. He said back in 2018 in this climate change summit in San Francisco, never before in human history have we been so forewarned of a doomed destiny. Was talking about climate change, obviously, but never before in human history have we been so forearmed with the knowledge and tools to alter that course of that destiny. Meaning, we know that climate change is happening, but we also know the solutions. So the time to act is now. I'm sorry if I overstepped the time limit, Dr. Angel, but that's the end of this. Yeah, thank you.
Thank you, ma'am. That was a very fantastic talk. I think all of us were just glued to the screen and listening to you. Thank you very much for that. So we have three questions. One is, I would like to know how we can assess carbon footprint emissions or other proxy indicators in our clinical setting practically? I hope, I think that person wanted to leave. So he said, I hope there's a recording with the answer. So,
Yeah. So assessing our footprint, there are many tools that have been developed globally. In fact, WHO has actually put out two of those, which unfortunately are not user friendly. So, some we can use it, but it requires some handholding. So I think WHO CRO office and WHO regional offices is also trying to make that build that capacity for assessing the climate footprint. We ourselves are hoping shortly to be able to customize that footprint for India and make it user friendly. So, which will help us actually assess our footprint, especially for big chunks like energy and water and waste management. Supply chain is a big one, but we are hoping to have a customized tool for India soon.
so from
There are
another
global
participant.
tools. That's what I wanted to say. There are global tools. Yeah.
Okay, thank you. So it sometimes feels futile to care about minimizing our carbon footprint when there are pointless wars being waged. If the latter keeps happening, does the sector level mitigation have any meaningful impact?
A very philosophical question, I will say. I mean, all of us are concerned about the war for sure. That is something that all of us would like to see the end of. But in the meantime, like I said, we take the Hippocratic oath of do no harm. So, in our own small way, if we can do what we can, I think it's a drop in the ocean, but it will make a difference. Philosophical question that requires a philosophical answer.
So, Madam, most of these initiatives are at policy or at a government level with funding. How intervention can be planned at community level with minimal or no budget to address climate change on health?
So, like I said, I think there is very many pots of money. I think people just don't get to know. I think within the Ministry of Health, there is the National Program for Climate Change and Health, which is being funded by a certain, resource within the government of India to carry out these changes through the program. And obviously, always there's the gap between the program and the implementation because this goes from national government to state government. At the state government level, state health being a state subject, decisions often can be taken, which are not exactly conducive, but there is money that is allocated every year for this program. There's mandated small, low-hanging fruits that are mandated as interventions every year. I was working closely with the program, so I know this is a fact. It's just the blueprint for action that has to be taken at the implementation level that is not clear. And I think we are trying to work hard towards filling that gap.
So, going to the next question is how can we integrate climate vulnerability assessments into routine epidemiological studies, such as TB or vector-borne diseases, to better predict and mitigate health impacts in high-risk regions?
Yeah, I mean, there are different organizations that have done these vulnerability assessments at national level, at regional level. All of them have focused on different things. So there is one group that has done for hydromet disasters, like floods and this thing. But there are ways to integrate both health data as well as climate data and do these predictions and hotspots, future hotspots, for example, for mosquito-borne diseases or for heat-related illness. These are technical assessments and which needs expertise. But again, we are hoping that we can work with the government to make this happen. This is a capacity that has to be built.
So the last question, what skills should a public health professional focus on if they want to work at the intersection of climate change and health?
There's very many angles that you can work from. I think definitely if you're a healthcare professional as a doctor or a nurse, definitely first and foremost, call to action is to deliver care, and for which I was already talking about the need to increase that knowledge and awareness. It is not part of the medical curriculum, and it is not only in India, it is around the world. This climate change and health impacts is not part of the medical curriculum anywhere in the world. It is changing. Everybody was doing their best to make this happen. In the meantime, these are our little efforts to kind of make that awareness happen. So first and foremost, I think if you're a medical professional, your first call of duty is to be there for acute climate events and the health impacts that happen after that. But from the public health lens, there's so many different ways you can contribute to build your skill sets for doing these vulnerability assessments at regional or district or hospital level, to allow them to understand what is their regional vulnerability, and then to work from all of these lenses. There's think about infrastructure resilience, there's functional resilience, there's how can you help them in terms of the energy use, the water use, doing energy audits, water audits. There's so many different things. And community resilience, awareness in the community is also important. So I think there's a lot of work to be done, and it's a collective responsibility, like I said before.
Okay. So, yeah, one more. Madam, is there any course to upskill about climate change on health in India?
The government itself, I think we, through the national program, have developed a lot of courses which we are delivering to the health sector. It's a continuous effort. And I think if you go to the website of the National Center for Disease Control, I'm hoping they were going to upload all of those materials. But there's lots of organizations. We ourselves have done a lot of training. We recently did a global effort for the Southeast Asia region on climate and health for health responders in the Southeast Asia region. I don't know if those recordings would be available, but it was a whole series of about 14 lectures, which we did monthly. And those are available also, I think, online somewhere. But I can look for it and share with you, Dr. Angel, to share. Yeah.
So, yeah, so that brings us to the end of this webinar. Thank you, ma'am. That was a very nice way to start this series. So I'm sure the more webinars in the series will keep everyone engaged. And I think all the participants were uniformly throughout the whole webinar. So thank you for that. So thank you all for attending. And we will be posting this in our YouTube channel of the card project, and it can be accessible later. Thank you all.
Thank you. Thank you so much, Dr. Angel, for the opportunity.